Cardiovascular disease is the leading cause of death for both men and women worldwide. By 2050, more than half of U.S. adults will have it. Here's the crazy thing. About 80% of the problem is preventable. But our first guest says there's one simple thing you can do to stop heart disease before it even starts. Dr. Mayank Agarwal with Modern Heart and Vascular is here to clear up some common myths, break down what to watch out for, and share the secret to keeping your heart healthy. Hello there.
Yeah, good morning. How are you?
Good. All right. So you went to medical school, you could have done all kinds of things, but why did you decide to focus on the heart?
So heart disease, obviously leading cause of death in the US, worldwide, but cardiovascular is very fascinating. You know, you can see a patient from beginning and kind of guide them through their whole life with preventive measures, treatments. So it's a very fascinating field.
Yeah.
There's always new things coming out, new medications, new treatment options, new prevention stuff. So it's a fascinating field to be part of.
All right, so when it comes to the myths, I think a lot of times with myths around health, we kind of stick to them because it makes us feel more comfortable, like, oh, it doesn't run in my family, so I don't have to worry about it, right? All right, so one of them is that heart attacks, that's more of a man's problem.
Oh, that's incorrect. So for females specifically, you know, crazy thing is Friday was Go Red Day, and we're part of Heart Month, and for females, it is the leading cause of death, even higher than breast cancer that most people think about.
Yeah, because it's kind of a 50-50, men
Correct.
and women, right?
Correct.
All right, another myth is that, oh, that only happens to old people.
Oh, that's incorrect. You know, my youngest patient actually was in the late 20s that had a heart attack. So it doesn't target only older people, males, females. It's everyone. Everyone's susceptible for it.
And actually, you've seen even more in a younger population since COVID, right?
Correct. Yeah, and a lot of sudden cardiac death, a lot of arrhythmias. COVID has kind of changed the body specifically, so we have definitely seen an uptake of cardiovascular disease after that.
Yeah, and the other myth is that, oh, it's only for overweight people. I'm fit. I can't tell you how many fit people I know have had heart attacks.
Correct, and that's where, you know, prevention and screening is very important because our genetics play a big part of this, you know, and you can be that healthiest person you think, but underlyingly there's a lot more going on than just, you know, your weight and stuff.
Yeah. All right, Dr. Agarwal, if a heart attack was coming, I would know because I feel all the symptoms and I would know when one was coming. Unfortunately, sometimes for a lot of people, the first sign of a heart attack is the actual heart attack.
Correct.
But they may not have paid attention to some things that could have been leading up to it.
Right. So, you know, everyone knows the common things: chest pain, shortness of breath, but certain things like fatigue or just not feeling right. Sometimes belly pain can mimic that, and we're thinking, hey, that's just acid reflux.
Yeah.
But you know, sometimes that could be a sign that you might be having a heart attack as well.
Yeah, but the problem is it mimics so many other things that are easy to excuse.
Correct.
And we kind of put it off. And also, women and men may present differently. Unfortunately, a lot of the research that oftentimes happens in medicine was in cardiology was done on men, but
Yes,
now we're realizing that there's some differences just by being female.
Correct, yes, and specifically for females, shortness of breath is a very common thing. And like I said, we're thinking about chest pain, but it's not always that crushing chest pain that is shown on TV. And for females, you know, shortness of breath might be that first symptom where they're just feeling winded, feeling tired, short of breath, just doing daily activities, and that could be the sign.
Yeah, all right. I mentioned earlier that about 80% of heart disease is controllable and in our own hands. And as much as we say it about lifestyle,
Correct.
I think oftentimes we keep dismissing that because we think it can't be that simple. It is that simple. So one of the simplest things is when they say, let food be thy medicine, eat better.
Oh, I agree. You know, a lot of times as providers, it's easy for us to be like, hey, let's eat fruits, vegetables, and stuff like that. But for me, I follow a rule of two. So for example, if a patient comes in and they're saying, hey, I eat fast food 4 times a week. So I'm like, hey, let's work on splitting it into 2. So 4 times over a period of 2 weeks. You know, small changes like that over a period of weeks to months makes a big difference rather than, hey, you're going to eliminate all the sodas, all the fast foods out completely, and then you start having these hunger cravings afterwards, and you're actually kind of rebounding because you're craving those foods. So you want to take a step-by-step direction to where we can, you know, slowly cut out or eliminate some of these things.
And understand what you're doing, because like it's not necessarily that fast food by itself is problematic. Correct. It's what kind of fast food are you doing, right? There, you know, especially here in Houston, you have so many other places that you can get it quick, fast, and in a hurry, but it's good, nutrient-dense, clean food, right? All right, be more active.
Right.
And that doesn't mean you have to run a marathon, because that
Correct.
will never happen in my life.
Yeah.
But there are ways to make small changes.
Correct. So, when we talk about being more active, the first thing that patients think about, hey, I'm gonna go get a gym membership, I'm gonna go work out. But hey, all it starts off with, American College of Cardiology, American Heart says you wanna have 150 minutes, so about 30 minutes of moderate exercise a day, but does 23 and a half hours a day what you do, The best thing people can do is get out and walk. Small things like people circle the parking lot to find the closest parking spot, but hey, just take your time, just be in the back and then kind of walk there. Or we're going to check our mailbox. People park right in front of the mailbox to our community mailbox rather than, hey, I'm going to walk down the street. So my patients, I try to strive for them. Let's do 10,000 steps a day. So we have smartwatches, we have all these fancy technologies. If we can get out and be active, just avoid the elevators, let's go up the stairs. Small little things like that add up during the daytime, and we're being more active.
And celebrate the fact that you can do it. Because there are so many people who can't. People go, back in my day, I used to, well, if you kept doing these small things, maybe that prolongs the ability to do that. Obviously, quit tobacco, healthy sleep. We underestimate sleep. Good sleep is when the body has a chance to repair itself.
Right, and sleep is something we take for granted so much, we want to get a good 7 to 9 hours of sleep, but sometimes, certain conditions are preventing us. So, if you're snoring, if you've noticed you've been snoring a lot at nighttime, you are kind of having that daytime fogginess, you're feeling very sleepy, you might have sleep apnea. And a lot of times, certain things like that can make a big difference because that's heavily linked to heart cardiovascular disease. And getting a good night's sleep, it helps a lot. A lot of times, people wake up at night and they're out, going to their pantry or their kitchen fridge, trying to grab a late midnight snack,
Yeah, stop that. All right, but speaking of, manage your weight, control cholesterol, manage blood sugar, manage blood pressure. All right, if you have symptoms, obviously come in and get checked, but really at some point, everyone should make it part of their physical. Who should get screened? And by the way, I did the screening that you all have. It was amazing. It took just a couple of seconds really to get it done, and you can see literally if a heart attack is coming in somebody, or if you can just go about your way. So I don't know what you saw there, but you can decipher what that is. But does that look like a healthy heart? But to get screened, so you have a baseline, and then know what could be coming your way, so that you can prevent something.
Right. So our heart scan or CT scan that we have, you're able to look at the arteries very closely, see if there's already plaque buildup, that started, and those are early signs of like, hey, we need to do something to work on your lifestyle, whether it's with medications, diet, all that stuff. So the technology is very amazing, very fascinating. It's quick, 15-minute thing, come in and out, and you get a good idea of what your arteries in the heart look like, if there's any other structural abnormalities.
Yeah, you could literally predict if a heart attack is coming and prevent that. Dr. Agarwal, thank you.
Thank you so much.
All right, to book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com. You can also call 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so please contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball and the Medical Center. They're also fluent in Spanish, and they deal with vein issues as well, because that's part of the cardiovascular system. Well, for many of you, the best